Coagulation.
Good morning, class. I hope you guys are excited and ready for today's class. My name is Daniel Wallace Mullins, and I am your biochemistry teacher for today. All right, so let's not waste any time. Let's get into marking the register. Shamilia Richards.
Present, Miss.
Nadine Simpson.
Am I name Miss Just Call?
You don't know your name.
Present, Miss.
Apisha Spence.
Present, Miss.
Ashanti Small.
Present, Miss.
Good morning again, students. The topic for today's class is coagulation tests. And as you know, today you will be doing your graded coursework presentations on the different types of coagulation tests. I expect A1 presentations from you all because those biochemistry exam grades don't look good at all. And you should be trying your best to make up for it. Okay, so let's get into today's class. What is coagulation? Coagulation is the process by which the blood changes from liquid to gel, forming a blood clot. If a doctor suspects that you have a coagulation disorder, they may recommend one or more coagulation tests. And today, you should be presenting on prothrombin time, hemophilia tests, occult blood tests, and partial thromboplastin time. Each presentation should include what is the test, how the test is done, preparation of patients, interpretation of results, and its significance to health and illness. Now, students, you can go right ahead with your presentation. Let's start with Shamilia Richards.
Okay then, Miss. Alright. So today I will be doing prothrombin time test. So a prothrombin time test or PT test is a test that is used for blood clots, or it measures how long it takes for your blood to clot. It checks for bleeding problems. It also checks whether or not medication helps for blood clots or not. PT can also be called INR, that's International Normalized Ratio. Preparation of patients is that normally it is performed after fasting. So a patient has to undergo fasting. So a healthcare professional will normally do it from either your vein or your fingertips. So a small needle, something like what I have here, is inserted in the arm, and normally would feel a slight pinch. And for the fingertips, the test is normally done in a provider's office or in their home. Also note, for persons who are taking warfarin, your provider may recommend your test be regularly used at home, or you can use a PT or INR test kit, something like what I have here. During this test, you or your provider will use a small needle to puncture your fingertips. Collect a drop of blood and place it onto a test strip or other specialized instrument, then place the instrument or test strip into a device that calculates the test results. Your handling of sampling. Collect 3 to 5 ml of venous blood in a blue top tube containing 2.3 sodium citrate until it is filled to its capacity. Test the blood within 2 hours time to prevent the inactivation of some factors. Transfer the blood sample drawn immediately to the laboratory with ice packs. Note briefly, if the blood sample is clotted before testing, a new sample must be taken. List on the laboratory slip the drugs the patient is taking that may affect the test result. Explanation of how the test is done is that, as I said, a phlebotomist collects venous blood samples in plastic tubes with a light blue top that contains 3.2 sodium citrate. Sodium citrate serves as a chelate the calcium in the blood sample and prevents the activation of coagulation cascade. The chelation keeps the blood sample in stasis until ready to be tested. Tube filling must be within 90% of the full collection volume with the blood to sodium citrate ratio from 9 to 10. The tube is then gently inverted a few times to mix the sodium citrate solution with the blood. The tube should not be shaken to avoid hemolysis that would lead to inaccurate results. Once the blood sample is ready to be tested, calcium chloride is then added to restore the calcium required for coagulation activation. The interpretation of results now is that the results are normally ready within seconds. These results are standardized using international normalized ratio. Results can either be prolonged or normal. Our normal results are if blood clotting occur within a range of at least 10 to 12 seconds. If clotting occurs after this, the patient is suspected of having a clotting or bleeding disorder. There are a lot of significance to health and illness, but I'll just give you two of them. So very few risks are associated with having your blood drawn for PT test. However, if you have a bleeding disorder, then you're slightly at higher risk for excessive bleeding and hematoma. So hematoma is when blood accumulates underneath the skin. And another one is that you may need to test regularly if you are taking warfarin on a regular basis. Thank you.
Nadine Simpson, you're next.
May I come, miss? May I look for the document? Sorry, miss. Me find it now. Good day, class. Today I will be presenting on hemophilia test. First, hemophilia is an inherited bleeding disorder which causes the blood to not clot properly. To test for hemophilia, you must first prep the patient. The patient must avoid ASA, most popularly known as aspirin, and avoid strenuous activities prior to blood draw. When doing the test, there are specific ways to handle the samples. Blood samples should be labeled immediately after specimen collection, with the patient's first and last name, identification number or date of birth, and the date and time of the specimen collection. Blood samples should be collected in a citrate tube containing 32% aqueous trisodium, citrate dihydrate capped during processing and kept at 18 to 25 degrees during transport and storage. Blood samples should be centrifuged at ambient temperature for a minimum of 10 minutes and be analyzed within 8 hours of collection or stored deep frozen at 35 degrees Celsius. An explanation of how the test is done. The method veini puncture. Veini puncture method, blood is collected from a vein inside the elbow or the back of the hand. First, site is cleaned with antiseptic. Place an elastic band around the upper arm so veins become more visible. Insert needle into the vein and collect blood sample into an airtight tube. Remove the elastic band, then the needle from the arm, and cover the spot with a bandage to stop bleeding. Significance of health and illness and interpretation of results. Lower than normal levels of one or more clotting factor, for example, less than 1%, indicates severe hemophilia. Higher than normal levels of more than one clotting factor may mean you have a disorder that makes your blood clot more than normal. Test results may vary based on age and gender. Hemophilia is more common among males.
Okay, so since Nadine can't find the rest of the information to present, I will tell the class because this is important to know. The equipments used for hemophilia tests are antiseptic fluid, cotton, needles, syringe, light protected container, bandage, and a blood pressure machine. The methodology is amniocentesis. The patient's abdomen will be cleansed. They will be instructed not to touch their abdomen during the procedure. They will be injected local anesthetics. This may cause a brief stinging sensation. Ultrasound will be used to help guide a long, thin, hollow needle through the abdomen into the uterus and the amniotic sac. This may be slightly painful. The doctor will then withdraw a small amount of amniotic fluid into the syringe and bandage the site of the needle. The fetus heart rate and vital signs will be then assessed, and the amniotic fluid will be sent to a lab for examination. And that is the methodology of the hemophilia test, students. You can go ahead now, Apisha.
Good day, teacher and students. Today I will be presenting on fecal occult blood test. Let me tell you about something that I learned, even though it did require enough research. Hours upon hours on the screen I spent just to know what occult blood test meant. First of all, let me share the meaning. It is a test for blood in the stool hiding. If the test is positive, then you know what that means. Some part inside of you most likely bleeds. Hemorrhoids, polyps, diverticulosis, ulcers, colorectal cancer, colitis are all the conditions that this test depicts, and the digestive tract is where these issues exist. One more thing I should add to this list. Fecal occult blood test can't tell what is amiss. If you need to know what's going on inside your body, it's best to follow up with a colonoscopy. Next is where I tell you how this test is done. Immunoassay, a test that's just no fun. It measures what is present in a solution using an antibody, the explanation. Non-sterile specimen contain FOB ticket with an applicator, and when you're done, perform number 2. On a card, it applies just a smear of stool. Room temp samples are transported and stored for 6 and 30 days inside the cold. The sentence above, storage is what I mean. For non-sterile containers, 1 day is ideal.
Ashanti Small, I know you're a shy girl, but remember, it's a graded coursework, and in this class, we're all a family. So there's nothing to be afraid of. Do your best, and you won't have to worry.
Good morning, everyone. Today I will be presenting on partial thromboplastin time. Partial thromboplastin time is the blood test that tells how long the blood takes to clot. Special preparation is needed for PTT, but healthcare providers require patients to stop taking certain medications like heroin before the test because it can affect the results of the test. And after, the sample should be stored and transported at room temperature. If the sample exceeds 2 hours without being in the lab. The sample is then centrifuged for 15 minutes at 2000 to 2000 milligrams. After the separation of the plasma can be stored up to 24 hours at room temperature. Methodology of PTT. How is the sample collected? A nurse or a phlebotomist draws blood from the vein of a patient by standard phlebotomy techniques. Blood is collected in a collection tube containing citrate. The citrate binds calcium, which inhibits clotting in the tube. This allows for a whole blood sample and an effective extraction of plasma for testing. PTT test uses decalcified blood to prevent clotting in the tube before the test begins. Lab plasma is separated from cellular components by centrifuge. Calcium and activating substances are then added to the plasma to begin the intrinsic pathway of the coagulation cascade. Interpretation of the results. PTT tests are measured in seconds. Normal PTT test results are typically 25 to 35 seconds long. This means that it took the blood sample 25 to 35 seconds to clot. An abnormal PTT result does not diagnose any particular disease. It only gives insights on the time it takes the patient's blood to clot. Some diseases and conditions that causes abnormal and prolonged PTT results are deficiency of blood clotting factors, hemophilia A or B, nutritional issues, leukemia, liver disease, and many others.
Okay, thank you guys for your presentation. Some of you did very well, some of you not so well. But I will email you your grades by tomorrow and you will know the grades that you got. All right, so remember now, biochemistry exam is next week, Monday. It is your first exam. I hope you've already started preparing and I wish you all the very best. May you all pass your exams.